stem cell prolotherapy is getting a lot of press nowadays, and let's be honest, I mean, really, stem cells really probably are, for right now, the future of medicine. So I'm really, really excited just to be part of it. So I can't wait till where, you have a heart attack, then they're regenerating your heart tissue with stem cells. You have a stroke, right? And then they're regenerating your brain tissue with stem cells. Hopefully, with spinal cord injury, somebody has a spinal cord injury and right away they inject stem cells into the spinal cord and maybe save some people from getting, a complete spinal cord injury. So, whenever you're talking about what are the indications for a therapy, it's basically when that therapy is going to work better than just the ordinary therapy. So I have to answer, when is stem cell prolotherapy better than regular prolotherapy? So I want to answer it first off. The most important thing is where the injections are done. When I teach prolotherapy, everybody's about the solution, and they don't get better. You guys, you would be shocked at how many people I see in the office here that have gotten 1 or 2 shots of stem cell prolotherapy by other facilities, even outside the country, and they spend $10,000 to $15,000. And I'll do a regular prolotherapy, $500, $700, and the person will say, the other thing got me 10% better, that regular prolotherapy got me 50% better. It's where you give the injection. So the number one thing is where you give the injections. Until doctors who do, whether it's stem cell prolotherapy, other prolotherapy, or surgery, until they understand joint instability. In other words, you have a meniscal tear, or you have a cartilage issue related to your knee. You have a cartilage issue, right? And you're going to go outside the country or somewhere and get some sophisticated thing, $15,000 or whatever. If you have your ACL ligament that's loose, right, and you get a $15,000 procedure with all these stem cells, and your joint's still bam, 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 because your ACL's loose and they didn't treat your ACL, and it's still loose, it's a complete waste of money. You know what I mean? So until people understand joint instability, that you have to treat the whole joint, until that's accepted and norm for prolotherapy, the bottom line is you got to treat the whole joint. So let's just assume somebody's going to get the whole joint treated. Then it's just a matter of, do you need an additional procedure, which is the stem cell procedure, to heal the tissue? So in other words, it's a given that you're going to get all the areas treated in your knee, in your shoulder, in your hip that are degenerated, painful, and or part of what's causing your pain. Like, in other words, Dr. Hauser believes it's not one thing causing your pain. It's like 16 things causing your pain. Because you had the problem for 10 years. It's not going to be one thing. If you had the problem for 2 days, it may be one thing. But even then, if you have a meniscal tear, like you've had a meniscal tear for 2 days. So in other words, the trauma that you had that caused the meniscal tear, you're saying it didn't tear anything else in your knee? It didn't tear your medial collateral ligament? It didn't injure the cartilage? It didn't injure the tendons? Like, it did. It did. So if you want to get better quicker, you got to get all those areas treated. So the main indication that I use stem cell in the office here is when a person has an advanced condition. They have advanced osteoarthritis. That could be an indication for stem cell. They have a big osteochondral defect. Like, in other words, on MRI or on arthroscopy, they showed that they have a big lesion in the cartilage where the cartilage, it's like a hole. They literally have a hole in the cartilage. It's a full thickness tear of the cartilage. There are going to be times where you have an advanced ligament or tendon issue, like you have a complete rotator cuff tear, or you have a severe degenerated ligament. Like, in other words, you've had regular prolotherapy, and it hasn't responded to regular prolotherapy, the ligament, that we might consider stem cell. Another indication where I would consider stem cell would be as if you had a labral tear or meniscal tear. But most of those conditions can respond just to regular prolotherapy. But there are, like, I'll give you an example. Grandma Jones has a labral tear in her shoulder. Like, all she wants to do is knit. Johnny has the same exact labral tear, and he's an elite tennis player. Like, do you think Grandma Jones and Johnny, I should treat them the same even though they have the exact same lesion? Like, I don't think so. I don't think so. Grandma Jones is going to be so much easier to get her better. Like, you don't have to be drilling into her bone. She doesn't want you drilling into her bone. She doesn't even want to go to doctors. Like, she just wants simple. So just use dextrose prolotherapy. We'll get it strong enough so she can knit. Johnny, he's an elite athlete. He, is an NCAA tennis player. Like, he doesn't have time to dink around. So you do stem cell prolotherapy. You do stem cell prolotherapy on his shoulder. And you're gonna, in other words, for him, that's the best treatment. So those are kind of the main indications, for stem cell. It'd be advanced osteoarthritis, like bone on bone. Somebody has an osteochondral defect, like in other words, they have a big hole in their cartilage. 3 is you have like a high-level athlete who has a serious injury and they don't have a lot of time. That would be another one. And then some of the indications would be a really, really severely degenerated tendon or ligament that hasn't responded to normal prolotherapy.